Today's topic is swimmer's ear. Swimmer's ear is a terminology which defines a condition called otitis externa, that is, inflammation and infection of the external ear. After a gap of 2.5 years, swimming pools have finally opened and children are loving it. They are going into the water, they are swimming for hours on end, and sometimes this predisposes to the condition called swimmer's ear. Swimmer's ear is caused when water enters into the ear and stays there and causes an infection which could be bacterial or fungal. This usually happens if you swim in waters that are not sterile. For instance, beach, pond, lakes. Swimming pool waters are usually safer because chlorine has been added, sodium hypochlorite has been added, and the water is made sterile for you to swim in. Swimmer's ear is caused because water goes into the ear, and especially if there is some wax lying in the ear, the wax itself gets wet and subsequently the accumulation of water in the ear causes an infection. What are the symptoms of swimmer's ear? The symptoms are ear blockage, ear stuffiness, itching in the ears, pain in the ears, and impairment in hearing. Swimmer's ear usually starts off with an initial feeling of itching or blockage, and gradually as the infection spreads, there will be impaired hearing as well as pain in the ear. Sometimes the pain can be so intense that the patient may not be able to sleep at night also because of the pain. How do we prevent otitis externa from happening? There are some simple methods. First of all, try to use some protection when you go inside the swimming pool, like an earplug, or wear a cap so that water does not enter your ear. Second is, try to prevent yourself from swimming in unprotected waters like beaches if at all possible. If there is water in your ear, just try to put a dry swab here and try to soak up the water. Please avoid putting things deep inside your ear canal because you can damage it. There is a home remedy available, particularly if you come back from the swimming pool and you find your ear is wet, or if you are prone to swimmer's ears and you want to go for a swim. An equal quantity of acetic acid with alcohol. Acetic acid is your simple household vinegar. If you mix a small amount of acetic acid or vinegar with some alcohol, equal quantity, and add a drop or two in the ear, it will keep your ear safe. The vinegar works against fungus and the alcohol is an antiseptic agent. Make sure you do not use this agent if you have a previous perforation, if there is a history of ear surgery, or if you are unsure about your ear condition in any way. This is just a simple household remedy which is recommended all over the world and generally keeps your ear safe. What should you do when you develop a swimmer's ear? The first and foremost is to try and put some antiseptic ear drops. Some antibiotic antiseptic ear drops are available. They could be over the counter. You can try and put those. If you have some discomfort or pain, there are pain relieving ear drops that you can use to put inside the ear. If you have itching and blockage, it is possible that you may have a fungal infection, in which case antifungal drops would be necessary so that the fungus can be controlled. When should you see the ENT specialist? When there is blockage that is not going away, when there is pain that is increasing, when there is intense itching, and when you feel overall your symptoms are increasing and not going away, you should consult the ENT specialist. What will the specialist do in that case? Normally, we take a look at the ear canal. There could be some wet debris like fungus which we remove. There could be accumulated wax which we remove, usually by syringing or by some other method. If there is an infection in the ear canal, we will use antibiotic, antifungal, anti-inflammatory packs to reduce the swelling, the pain, as well as the infection. There may be repeat visits that are required. In certain instances, particularly if you are immune compromised or if the infection is severe and extensive, a systemic or oral antibiotic may also be prescribed which works against your skin infection. Things that you should not do. First of all, avoid putting things inside your ear like earbuds or clips or pens and needles. Because you are going in blindly, the ear canal is a narrow and tortuous structure and you are likely to damage the very sensitive ear canal skin, which will lead to pain increasing as well as increase the chances of you catching an infection. There is a tendency or household remedy of putting oil inside the ear when the child comes back, and we feel that you boil some oil and cool it down and put it inside the ear, which will take care of the ear problem. This is the worst possible thing you could be doing, because the oil prevents the ear canal skin from breathing and promotes and multiplies fungal infection. So please, particularly if you're suspecting swimmer's ear or you have an ear problem after swimming, do not put oil in the ear. It is likely to increase your discomfort. Avoid putting insert earphones in the ear, because insert earphones can sometimes damage the ear canal skin and make your condition worse.